My name is Jeffrey Radoff. I'm a doctor who does integrative medicine. Integrative medicine uses all my allopathic professor knowledge along with natural cures, especially homeopathic. This video is about foods, and especially foods that you are allergic to, sensitive to, and phenolics. Phenolics are hexagonal rings. They're chemicals in foods, and they're made by microorganisms in the body. It's very important that these phenols get metabolized properly. Otherwise, they cause neck pain, lower back pain. Different phenols cause dermatitis, itching, psoriasis. Other phenols cause urinary tract infections, bedwetting at night. There's a very famous allergist named Dr. Feingold who invented the Feingold diet. The Feingold diet is for children. It eliminates salicylates and phenols. Salicylates are just one kind of phenol. Aspirin is a salicylate. Interestingly enough, children become hyperactive with certain phenols, yet adults get chronic fatigue from these same phenols. We have methods in our office to test patients for phenols and make neutralized homeopathic medication to stop the adverse effect of the phenols. We have had very great success, and at the end of the testing, we come out with a diet.
So the phenolic scan will come with a diet. The diet will include up to 3 to 4 weeks. The first week, while you're taking the drops, because you will receive some drops as well with the phenolic scan. On the first week, we're going to highlight which foods have the phenolics in it that you tested positive for. So anything in week 1, you're going to try to avoid. If you eat them on a daily basis, try to decrease the amount of how much you actually eat them. So if you eat them every day, try to do like every 2 days, every 3 days, if not every other day. But try your best to avoid any foods in week 1. Once you're done with week 1, while you're still taking the drops, you're going to continue to week 2, and you're going to repeat the same process. Try to avoid anything that's in week 2 while taking the drops. You can reintroduce all the foods that were in week 1 and while you're on week 2. So anything week 2 you have to avoid, and week 1 you can reintroduce. The same thing with week 3. You are going to repeat the process again. Avoid as much as possible as you from the foods on the list, and then reintroduce foods from week 1, 2, and then continue on to week 4. The same process, just keep taking your drops, and then in week 5 you can come back for a rescan and see how well you have changed the phenolics in your system.
Additionally, after you have a phenol scan, I'm going to give you a packet of information to increase your knowledge and depth of understanding of phenols. So many patients have come to me saying, I think foods are causing these problems, but most doctors have no way to test them. And if you do traditional allergy testing for foods, you can get a positive response. But also you can get a negative response because you're not allergic to it, but you're sensitive to it. There's a difference between allergy and sensitivity. Allergy works through the immune system, and sensitivity works in other biological mechanisms. For example, I once had a patient who was unloading a drum of chemicals. He got extremely short of breath and was wheezing. Well, this wasn't an allergy, this was an irritation from the chemical. I myself have asthma. It gives me at times some extreme shortness of breath. I've been tested, and I'm allergic to many of the pollens in Phoenix and some foods. When I walk through a perfume counter in a mall, it takes seconds for me to get a stuffy nose, and if I stay in there too long, I'll get short of breath. That is a sensitivity. think it's important for patients to realize this, and we can do both allergy testing and the phenol scans and do an extremely comprehensive evaluation and treatment plan for your needs. Thank you.